first thing you should do when you're doing oral hygiene instruction for your patient is ensure that the patient is quite clear about what the condition of their mouth is prior to you doing any work. So if you just begin by showing them what you want them to see in their own mouths.
Okay, can you just make sure that you can see there?
Oh.
Okay, can you see perfect in there? Okay, what I want you to do is just look really, really closely at the gums here. Okay, can you see this? And you just look really carefully, okay? Can you just see how this is a bit redder? The condition there, okay? The reason for this, you see this is calculus, okay? This needs to be removed. There's also plaque lying there on the gum line, which is just causing this to become inflamed. What we want to see is nice, firm, pink, healthy gums, and these are just a little bit red. Okay. Now, what we need to do is keep looking in the mirror. Okay. Can you see that here? Okay. Quite a build-up in the back of these here. Okay. And again, if you look at the gum condition, it's just causing your gums to be a bit inflamed there, okay? So, what I'd like to do, okay, quite a lot of this, the plaque, is almost invisible, okay? So what I'd like to do is just to pop a solution on here, which will just show it up, okay?
Okay.
Are you quite happy with that?
Yeah, no, it is difficult to see.
It's very important at this stage that you ensure that the patient's clear about what it is you're going to do.
Okay, so you're quite happy about what we're going to do. What we're going to do is we're going to pop this solution on, okay? And what this will do is it will show up any plaque there.
Okay.
Now this is a two-tone colour, okay? So some will be blue and some will be red, so it is going to stain, okay? But it will, by the time you leave here, it will all be removed.
Okay.
Okay, you're quite happy with that.
Patients should understand that they can remove their own plaque, but they can't remove calculus. And this helps with their oral hygiene at home, because you want them to be sure that they're taking part in their oral hygiene and looking after their own mouths and improving any condition that's there. So we're going to sort out their oral hygiene first, removing all the plaque, and then it's the role of the therapist hygienist to remove any calculus, particularly from supragingival areas initially, so that the patient can then manage to keep their own mouths clean. Using solution is preferable to using tablets in the mouth, because you don't end up with a pink tongue or pink roof of the mouth, and this is very specific. You don't have to disclose the whole mouth when you do this. You can choose to disclose one or two areas if the patient's having a particular problem.
Okay, so what we've done there, we've just popped the solution on, okay? And what has that allowed us to do? Can you see quite clearly here? This red, purpley area. This is where all the plaque is lying. Okay, so what we need to do, okay, at home, what we need you to be doing is making sure that you're removing all of the plaque, okay? And what we'll do is we'll remove the calculus that's on the teeth, okay? That you can't do that yourself, we'll do that for you. So what we really need is for you to be making sure that you are keeping these areas nice and clean, okay? Alright.
One of the important features of what's happened just now is that the patient's been able to see their tissues initially with the inflammation on, and now they can see the plaque specifically related to those areas of inflammation.
Can you see, okay, down here, you're just missing with your toothbrush, right down on the gum level, these teeth here, okay? So when you're brushing, we'll go over the toothbrushing. I really need you to be concentrating on these areas, okay? You can see you've got nice clean tooth here, but just where it's down on the gum level, see that purpley red, okay? Just as it is here, okay? So these are the areas that you need to work on, okay?
Okay, thank you.
The oral hygiene instruction that's just about to be given has to be specific for the plaque areas that the patient has. It's more important to be specific about your toothbrushing instruction than just to do a general, here's how I want you to clean the whole of your mouth. Make it specific to the patient's needs. The patient's now going to be given toothbrushing instruction for the areas that have been disclosed. In order to do toothbrushing instruction, you should have the patient seated upright. However, sometimes it's good to do your initial instruction from the 11 o'clock position, because that way you and the patient are seeing in the mirror at the same time. You're not doing your instructions in reverse.
Okay. What type of toothbrush are you using at home at the moment?
It's a small one from a supermarket.
Right, okay. What I would probably recommend for you is something that's quite a small head, okay, so that you can get right to the back, the long handle so that you can reach, okay?
Okay.
So what we'll do is we'll go over how to do this and then I'll get this away with you, okay?
Okay, thank you.
Okay. So when you brush in, okay, you really need to be making sure that you're taking it right down to this gum level. So we don't want you brushing up here, okay, which is what I think you've been doing in the past, okay? So what I want you to do when you're brushing, can you see quite clearly there? Okay. I want you to be brushing right down to the gum level there, okay? Now, don't want you to be brushing really, really hard, okay? Just small, gentle movements, okay? Alright? Okay? What I want you to do is to think about it, to go all the way around the outside, okay? And then all the way around the inside, and then to the top, okay? And always, always, always do the bottom and the top together, okay? Apart, okay? Separately. Never ever brush them all at the same time.
Okay.
30-second brush, okay? It does take a good couple of minutes to brush properly, okay? Well, just demonstrate that again, okay? Make sure you're brushing right into the margin. All the way around. Can you see that? Okay. What I'd like you to do is just have a little go with that, okay? Just make sure that you're getting the feeling everything of it, okay? So if I take the mirror for you.
Okay.
Okay.
Taking that hand.
Okay.
Okay.
Alright.
If you're holding the mirror for the patient, be very sure that your hand's not shaking, because then the patient gets a bit seasick. So try to hold the mirror very steady while you're watching what they're doing in the mouth.
Like that?
Okay, if you just come down a bit that, perfect. Good. Okay, just remember right down onto that gum margin, that's great.
Oh, it's going.
Yeah, you see that?
Oh.
Okay, what a difference that's making. Okay.
It doesn't take long to do oral hygiene instruction, and I
That's
really
very
wouldn't
good.
labour this too much. You just want to be sure that the patient can manage to do the instructions that you've
Now,
given
can I
them. You're
just
not
check with you?
ensuring
Remember
that
how
they take all the
before
plaque out right at
we
this
were having
moment.
a look down beside the tongue? What I'd really like you to do is to brush the inside of these, let's just see.
Yeah.
Yeah, right. Now remember, we want you to go right down to the gum line. Very good. Perfect. Excellent.
Patients who are right-handed always find it easier to do the lingual of the lower left than they do the lingual of the lower right. So it's often better to start your oral hygiene instruction on